Hello, I'm Nick Skumaravel. I'm a radiologist at UT. I'm the chief of musculoskeletal radiology and I'm a professor of radiology and orthopedics here at UT. Barbotage is a guided procedure where we use ultrasound to try and get rid of calcium that's formed in your tendons, which can be a cause of shoulder pain. There is no need to prepare for this in any particular way because this is not done under general anesthetic. It is done under local anesthesia, where we're going to sit you up, put in some numbing medicine, and direct a needle into your shoulder using ultrasound. So there's no need to prepare for this procedure. The procedure is done in a sterile environment with ultrasound guidance, where we use numbing medicine to numb the skin on the top. Then we use a needle to advance the needle directly into the rotator cuff tendon where you have the calcium. Then we break the calcium down. The calcium is broken by using either saline by itself or saline with some local anesthetic. Then we suck the bits of the calcium that's broken down out. Sometimes we're not successful at getting all the calcium out. That is still perfectly fine, because this would just mean that the intention was to break the calcium down rather than to get rid of all of it. Once we're done with that, we would inject a little bit of steroid and some local anesthetic to take care of the pain and the effect that happens after that. The typical relief from these is the local anesthetic works straight away, so you should have some pain relief after the procedure because we've got lots of local anesthetic into your shoulder at that time. The local anesthetic only lasts for about 4 hours or so. The steroid that we inject usually takes about 48 hours to work. So there's going to be some discomfort later on in the day after you have the procedure. So what I advise all our patients is to take some kind of painkillers. Typically the over-the-counter drugs are fine, which will take care of your pain for the first couple of days till the steroid starts working. After the first 48 hours, you should gradually get some pain relief in your shoulder, and it should be back to a level that's comfortable at the end of maybe a week or 10 days at the maximum. On an average, in majority of your patients, we find that it lasts for about 6 months or so. It doesn't get rid of all your calcium completely, but it's comfortable enough that you're able to use your shoulder, and the effect from the injection itself goes on for about 6 months. After 6 months, some of the patients come back for a repeat procedure, and sometimes they're able to continue even without a second procedure. It varies depending on a person-to-person basis. There's no major restriction. I would ask you to be gentle with your arm because it's going to be uncomfortable and sore. Don't lift anything very heavy beyond 5 to 10 pounds for the day or so. Give yourself some rest. Usually don't get back to aggressive activity about a week or 10 days. You should be able to get back to gentle activity afterwards and continue on to your regular activities beyond 7 to 10 days after that. The biggest downside is usually having a needle placed in your shoulder. Nobody likes that. We'll try and make it as gentle as you possibly can to put the needle in there. And one of the effects that happens when you break down calcium in a tendon is that it can also set off some inflammation or inflammatory process. And this can be resulting in some shoulder discomfort and pain. And that should be covered partly by the steroid that we inject. In some patients, the pain is a little bit more aggressive. In those situations, we request them to continue taking the painkillers for a longer period, like 2 to 4 weeks. Like in any needle-based procedure, you can get minor things like bruising, a tiny bit of bleeding is possible. One major stuff that we always worry about is infection. Infection is something that becomes a part of any needle-based procedure into a joint. So just like any other procedure, you would like to be careful about watching yourself over the next few days after the procedure. If you have increased warmth, develop a fever, in those situations, please reach out to your physician or to us to help you out.